Remember to subscribe and hit the bell icon to never miss an update from iMumz.
Causes of miscarriages. Hi mommies, today I'll talk about miscarriages. Nobody wants a miscarriage, but at times it is unavoidable. I, Dr. Anita Chaudhary from the holy city of Kashi, will tell you some of the reasons why it happens. There are many reasons why a miscarriage may happen, although there is no cause which can be actually pinpointed. If a miscarriage happens during the first trimester of pregnancy, that is the first 3 months, it is normally caused by problems with the unborn baby. About 3 in every 4 miscarriages happen during this time. If a miscarriage happens after the first trimester of pregnancy, it may be the result of things like an underlying health condition of the mother. These late miscarriages may also be caused by an infection around the baby, which leads to the bag of waters breaking before any pain or bleeding. Sometimes they can be caused by the neck of the womb, the cervix opening too soon, called the incompetent os. First trimester miscarriages. First trimester miscarriages are often caused by problems with the chromosomes in the fetus. Now, what are chromosomes? Chromosomes are blocks of DNA. They contain a detailed set of instructions that control a wide range of factors, from how the cells of the body develop to what color eyes our baby will have. Sometimes something can go wrong at the point of conception and the fetus receives too many or not enough chromosomes. The reason for this are often unclear, but it means the fetus will not be able to develop normally and it results in a miscarriage. This is very unlikely to recur. It does not necessarily mean that there's any problem with you or your partner. Placenta problems. The placenta is the organ linking your blood supply to your babies. If there's a problem with the development of the placenta, it can also cause miscarriage. Things that increase your risks in early miscarriage may happen by chance, but there are several things known to increase your risk of problems happening. Your age can also have an influence. In women under 30, 1 in 10 pregnancies will end in miscarriage. In women aged 35 to 39, up to 2 in 10 will end up in miscarriages. And in women over 45, more than 5 in 10 will end up in a miscarriage. A pregnancy may also be more likely to end in a miscarriage if you're obese, you smoke, you use drugs, drink lots of caffeine, and drink alcohol. Second trimester miscarriages. Long-term health conditions can cause this. Several long-term chronic conditions can increase your risk of having a miscarriage in the second trimester, especially if they are not treated or well controlled. They can be diabetes if it is poorly controlled, severe high blood pressure, lupus, kidney disease, hyperthyroidism, that is an overactive thyroid gland, hypothyroidism, an underactive thyroid gland, antiphospholipid syndrome, also called as APLA syndrome. Now, certain infections may also increase your risk. Infections like rubella, commonly known as German measles, cytomegalovirus, bacterial vaginosis, HIV, chlamydia, gonorrhea, syphilis, and malaria. Food poisoning is also one of the reasons which may end up in a miscarriage. It depends on what you have eaten. Things like listeriosis, most commonly found in unpasteurized dairy products such as blue cheese or unboiled milk. Toxoplasmosis, which can be caught by eating raw or undercooked infected meat. Salmonella, most often caused by eating raw or partly cooked eggs. Read more about foods to avoid in pregnancy. Now, medicines. Medicines can also increase your risk. To be sure, a medicine is safe in pregnancy always check with your doctor before taking it. Womb structure, the structure of the uterus. Problems and abnormalities with your womb can also lead to second trimester miscarriages. Possible problems could include growths in the womb called fibroids, an abnormally shaped uterus, a weakened cervix. In some cases, the muscles of the cervix, the neck of the womb, are weaker than usual. This is known as weakened cervix or cervical incompetence. A weakened cervix may be caused by a previous injury to this area, usually after a surgical procedure. The muscle weakness can cause the cervix to open too early during pregnancy, leading to miscarriage. Polycystic ovarian syndrome. PCOS is a condition where the ovaries are larger than normal, and it is caused by hormonal changes in the ovaries. And this is something so common these days. So, PCOS is known to be a leading cause of infertility as it can prevent the release of the egg. There's some evidence to suggest that this is also linked to an increased chances of miscarriages. Now, there are some misconceptions about miscarriage. An increased risk of miscarriage is not linked to your emotional state during pregnancy, such as being stressed or depressed, but chances are there. So, stay happy and relaxed. Having a shock or fright during pregnancy. Exercise during pregnancy, but discuss with your gynec what type and how much of exercise is suitable for you at different times of your pregnancy. Lifting or straining during pregnancy. Lifting heavy weights does not cause a miscarriage. Working during pregnancy or work that involves sitting or standing for long periods. Having sex during pregnancy. Traveling by air. Eating spicy food. Recurrent miscarriages. If you have had miscarriage, it's natural to worry that you'll have another if you get pregnant again. But most miscarriages are just one-time event. About 1 in 100 women experience recurrent miscarriages, 3 or more in a row, and many of these women go on to have a successful pregnancy. So the good thing is, if you've had one miscarriage, don't be disheartened. Go in for all the investigations that a doctor will advise. Go in for proper treatment, proper guidance, and I'm sure your next pregnancy, you will have a baby in your arms. Thank you and namaste.